response teams are being strengthened further in all states and union territories. So far, Government of India has evacuated 1,031 persons, including 48 nationals from countries such as Maldives, Myanmar, Bangladesh, China, United States, Madagascar, Sri Lanka, Nepal, South Africa, and Peru. Till date, 819 evacuees from these COVID-19 affected countries have been discharged after 14 days of isolation having tested negative as per protocols. Out of these, 654 evacuees from Wuhan, China on 1st February and 3rd February 2020 were discharged on 18 February 2020. 124 evacuees from Japan and 112 evacuees from China are being discharged from today onwards after having tested negative for COVID-19 in the second round of tests. We have spared no efforts to get our people back from any major COVID-affected country. We have sent scientists, equipment for labs, reagents, and brought back samples for testing from these countries. So far, 1,199 samples have been collected in Iran and brought to India for testing. We have even operated an Air Force flight to bring 58 passengers from Iran on 10th of March 2020. We have facilitated Iran air flight to bring back people from Iran. And today one flight with 44 passengers has landed in Mumbai, and these passengers are being kept in quarantine at the Navy facility in Mumbai. Another Mahan Air flight is expected to land tomorrow in Delhi. We are preparing to operate special flights to bring back Indians who have tested negative and are coordinating treatment of positive people in Iran as per protocol. We have sent a team of 4 doctors from the Ministry of Health to Rome. They have just reached Rome with sufficient material and reagents to collect samples of Indians there for onward testing in India. In addition, we have screened 11,71,000 passengers from 10,876 flights at 30 designated airports. 3,062 of passengers and 583 of contacts were identified, which were referred to Integrated Disease Surveillance Program and designated hospitals. We have brought 42,296 passengers under community surveillance, out of which 2,559 were found symptomatic and 522 hospitalized. 25,504 passengers have been additionally screened at major and minor seaports, and more than 14 lakh people screened at land boats. We now have 81 confirmed cases of COVID-19 in the country. Of these, 3 from Kerala were treated and discharged. In addition, 7 more from Safdarjung have also recovered. Of these confirmed cases, 64 cases are of Indian nationals, 16 Italian nationals, and 1 Canadian national. Contact tracing of these cases is being actively pursued. So far, this has led to identification of more than 4,000 contacts who have been put under surveillance. Death of a 76-year-old male from Karnataka is confirmed to be caused due to comorbidities, that is asthma and hypertension, and he also tested positive for COVID-19. All the precautionary measures as per protocol, such as screening and home quarantine of the contact, has been initiated by the State Health Department of Karnataka and is being closely monitored. It is reiterated that Indian nationals are strongly advised to avoid all non-essential travel abroad and refrain from traveling to countries reporting high cases and deaths as mentioned in our travel advisories. All incoming international passengers returning to India should self-monitor their health and follow the required do's and don'ts as detailed by government. In case of any sign, symptoms like fever, dry cough, difficulty in breathing, etc., please visit a doctor or call the Ministry's 24/7 helpline 011-239-78046. Remember to wear a mask before stepping out to see the doctor. Thank you.
Thank you. Friends, from the Ministry of Home Affairs, Mr. Malik, please add.
Good afternoon, friends. The central government has decided to regulate the international passenger traffic along the land immigration checkposts. We have 37 such checkposts. The central government has decided to allow this traffic only through 19 checkposts. The rest of the checkposts would be closed from tomorrow midnight for international traffic. This is to ensure that with the limited checkposts that would be remaining, we can focus on screening of passengers for COVID-19. Secondly, there are certain border haats that are organized in some parts of northeast India on the Indo-Bangladesh border. They'll remain suspended till further orders. Indo-Bangladesh cross-border passenger train and passenger buses would also remain suspended till 15th of April or earlier if so decided. Along the Indo-Nepal border, 4 checkposts would remain operational. Along Indo-Bhutan border, 2 checkposts, Jaigaon and Daranga, they would remain operational. Of course, for Bhutanese and Nepalese nationals, they have a visa-free entry in India that will continue. Secondly, central government also has decided to facilitate the state governments to use the funds of State Disaster Response Fund, SDRF, for fighting the COVID 2019, like funds for quarantine, isolation, treatment, etc., if the state or the NHM funds are not adequately available. Central government has decided to facilitate this use of this fund for this item. Thank you.
Anything you want? From the Ministry of External Affairs, Mr. Ravi, please.
Yeah. Good evening to all, and well, this is just to also just to reiterate the ongoing efforts that our combined efforts that are being put in place. It's on. It's on. So, with regard to the evacuation of Indians, both in Iran and Italy, I think that very strong efforts being made by the mission. Our ambassadors are in contact with Indians there, and their plans are all ready. So, both in Milan, Rome, and in Iran, we are our ambassadors and the missions in consultation and with the help of the local governments are making concerted efforts.
Mr. Ravina from Civil Aviation. Would you like to repeat? Take it in the question, Madam Ravina, Civil Aviation Minister.
Good evening, dear friends. In addition to what my colleagues have stated, I just wish to inform that today Iran air flight carrying 44 passengers landed safely at Mumbai airport, and with the help of all the arms of the government as well as the airport operator, seamless and smooth screening of all passengers, baggage clearance, immigration, customs, and the entire exercise was completed, and thereafter these 44 passengers were shifted to quarantine center of Indian Navy at Mumbai. Similar exercise would be undertaken tomorrow by Mahan Air, and we would expect Indian passengers stranded at Tehran to come to Delhi tomorrow, and they'll be landing at 0148 hours at Delhi airport. In addition to this, Air India is in full preparedness to take another flight if and when required to Iran. Another flight tomorrow, Air India would be taking and sending another flight to Milan to bring back Indians stranded at Milan, and this flight would take off at around 12 or 1 afternoon and would be landing on Sunday morning at 7:45 hours Indian Standard Time at Delhi airport. Thank you.
Friends, now we can take some questions, please. Please use the placard. 15.
ये मेरा सवाल अनिल मलिक जी से है। क्या आप लिस्ट बता सकते हैं कि कौन से लैंड बॉर्डर चेक पोस्ट के ऊपर ट्रैफिक जो है वो अलाउ किया जा रहा है, और ये क्लैरिफाई अगर कर पाएं कि करतारपुर कॉरिडोर जैसे जो हैं उसके ऊपर क्या फैसला हुआ है, करतारपुर कॉरिडोर ऑन रहेगा या बंद कर रहे हैं आप?
अभी जहाँ पे क्रॉस बॉर्डर मूवमेंट दैट इज ह्यूमन ट्रैफिक, इंटरनेशनल ह्यूमन ट्रैफिक जहाँ अलाउड है, वो है आसाम में Mankachar and Sutarkandi, that is Indo-Bangladesh border. बिहार में रक्सौल इंडो नेपाल बॉर्डर, मेघालय में दालू एंड डॉकी, दीज आर बोथ इंडो बांग्लादेश बॉर्डर, मिजोरम में क्वारपुचिया एंड जोगथार, जो क्वारपुचिया इज इंडो बांग्लादेश बॉर्डर एंड जोगथार इज इंडो म्यांमार बॉर्डर, त्रिपुरा में अगरतला इंडो बांग्लादेश, उत्तर प्रदेश में सोनौली इंडो नेपाल बॉर्डर, उत्तराखंड में बनबासा इंडो नेपाल, वेस्ट बंगाल में चंद्रबंधा, ये सारी इंडो बांग्लादेश वाली हैं वेस्ट बंगाल, कूच बिहार में चंद्रबंधा, हिली, फूलबारी, गोजाडंगा, हरिदासपुर, गेडे, चितपुर, रानीगंज भी वेस्ट बंगाल में है इंडो नेपाल पे, उसमें भी ट्रैफिक अलाउड है, जयगांव ये इंडो भूटान बॉर्डर पे है वेस्ट बंगाल, एंड दरंगा ये आसाम में है इंडो भूटान बॉर्डर पे। टोटल 19 चेक पोस्ट्स हैं जहां से इंटरनेशनल पैसेंजर ट्रैफिक वुड बी अलाउड फ्रॉम 00 आवर्स टुमारो नाइट।
25
जो अपडेट हुआ मेरे ख्याल से शायद 5 नए केसेस आए हैं, ये कहाँ पर हैं, किसी स्टेट में हैं, इनके बारे में कुछ बताएंगे?
देखिए, जो अभी मैंने जैसे आपको बताया, टोटल 81 पॉजिटिव केसेस अभी जो डिक्लेयर हुए हैं, तो इसमें इनका एक स्टेट वाइज डिस्ट्रीब्यूशन है। तो जिसमें शॉर्ट में अगर मैं आपको बताना चाहूँ तो जैसे केसेस हमारे पाए गए हैं दिल्ली में, हरियाणा में, केरला, राजस्थान, तेलंगाना, उत्तर प्रदेश, लद्दाख, तमिलनाडु, जम्मू कश्मीर, पंजाब, कर्नाटका, महाराष्ट्र एंड आंध्र प्रदेश में, तो इन स्टेट्स में पाए गए हैं अभी तक। जो लेटेस्ट ऐड हुए हैं, अगर उनमें देखें तो आंध्र प्रदेश से हैं, नेपाल, कर्नाटका से हैं, केरला से हैं और दिल्ली, यूपी, इन स्टेट से पाए गए।
156
Sir, I'm Joymala from.
156, please just
Yeah.
let her ask.
Sir, I'm Joymala from ANI. Sir, I just wanted to ask, like, we have seen exorbitant rate of masks that's been sold outside, and also there is the sanitizers are coming in the, which are coming in the market are of low quality, maybe of duplicate quality as well. So, how ministry is taking that on note?
See, there are two aspects to it. One is that our do's and don'ts clearly identify and have explained that hand washing by soap also is sufficient. So that is one aspect. Second is we have also indicated that we where and who should wear masks. So masks need not be worn by people in general. The point which I reflected yesterday also, that we need not panic. We should follow the guidelines which have been issued by government, the risk communication material which has been issued by government. Linked with that is the fact that if any exorbitant price will take place, we have already requested all the states to take action as per the law, and there is also a thought process that if need be, we will take even drastic actions for abnormal increase in prices, as and how we will see that how the situation is emerging.
13
So day before, Epidemic Act was invoked by the center. What exactly, could you please specify what exactly does it mean and how will it help center tackle the outbreak?
Okay. As my colleague just mentioned that, Disaster Management Act is also provided, and under the SDRF, the officials can now draw money and can take up the activities. I would just like to highlight that, first very important aspect to understand is that it is not a health emergency. I think there was some misnomer, some misunderstanding created for some reason that it is definitely not an health emergency. When we talk about Epidemic Management Act, then we are primarily trying to support the initiative taken by the state in terms of management of the situation. I would just like to read out the letter which Secretary Health has actually written to Chief Secretaries, which will primarily indicate what we are trying to, work on. So it is that as part of our management efforts, there is a need to impose certain social distancing measures, such as quarantine of exposed healthy individuals who could be potential patients or isolation of those with symptoms. Such measures required great persuasive communication. The persons to be quarantined or isolated need to volunteer for such measures in greater interest of the nation. There might, however, be cases wherein large community interest.
What we're listening to is an important update that's coming in from the joint secretaries of all the three concerned ministries, that is the Health Ministry, the Civil Aviation and the External Affairs Ministry there. Each of them informing the updates coming in, but the biggest, of course, remember, is the information of the number of positive cases in India has now gone up to 81. With that, it's a wrap on the big story. Stay on with us for more details.